Well, hi. Welcome to Wind Down Wednesday for June 2024.
Yeah.
Thank you all for joining us. And you can just put your questions in the comments section below, and we will be sure to answer all of those. So, hi, Janet.
Hi, how are you doing today?
Good. I love
Cheers.
that color scrub.
Thank you.
Looks so nice on you. So, we have some exciting topics, but first, let's talk about what we're drinking. And we're even promoting the wine.
Yep. Dauo Vineyard.
Dauo, pay attention to us.
Right.
Maybe you want to do a collab.
Yeah. This is awesome. I love the cups too. Anyway, we are drinking a 2023 Dauo Vineyard's Sauvignon Blanc. Sauvignon Blanc is one of my favorite whites.
Mine too.
And it's from our favorite region, Paso Robles, California.
Yep.
And I have to tell you, now I have not been to the vineyard, and I don't think you have either, although you've been to Paso Robles. This vineyard looks amazing. They started out actually creating Cabernet Sauvignon there, and they create a lot of different wines. So I can't wait to try some of the others.
Their cab is delicious.
Yeah.
I've had that. I have had this Sauvignon Blanc. As a matter of fact, that's how I got these glasses, because they were serving it at the Phoenix Open. And so I know how delicious this is, because I may have had a couple glasses that day.
Just a few.
Just a few.
And I looked up the flavors because my palate isn't that refined. Generous flavors of kiwi, quince, Granny Smith apple, and passion fruit.
Yeah, it was good.
Also scents of ripe pear, grapefruit, lemon, and freshly cut grass. Well, on to our specials before we get onto the subject of exosomes. So our specials for the month of June are Don't Sweat It. Some of you may know we now have the Brella underarm patch. It's a treatment that we do in the office here to help reduce excessive underarm sweating. We have saved $50 off one Brella treatment or $150 off two, because of course you would be retreating every 3 to 4 months.
And we did treat Maddie. She's behind the camera. You can't see her or her armpits for that matter. But Maddie is a super sweater. And Maddie, can you care to comment on what percentage of reduction?
I would say a significant amount.
Like, you think 50%?
Yeah.
Or
As much as
more?
I would
Like
say,
half?
I would say 50%.
Yeah. So
and
she's
I'm-
still sweating a little bit, but she was a super sweater.
Yeah.
And,
Right.
and we don't want to promote that this is going to stop sweating in patients who sweat a lot, right? If you have diagnosed hyperhidrosis, this treatment isn't going to make you completely dry without antiperspirant, but it will help your antiperspirant be able to work better.
And then our other special is Bright Eyes. Save $25 off a box of Upneek. Upneek is an amazing product that's out there that just basically works on the muscle here to open your eyes so your eyes are brighter. It
I
goes to work.
cannot live without that product. I use it every single morning. I honestly feel like I can see better.
Beautiful. And then we have saved $600 when you purchase 3 Morpheus 8 treatments for the face and neck. Beautiful thing about Morpheus 8 treatments is that it's colorblind. So it doesn't matter if you have fair skin, if you have darker skin, and maybe you can't do laser treatments, you can get wonderful rejuvenation benefits to help tighten the skin, to help with collagen stimulation, minimal downtime. You know, maybe 48 hours, that you can't go swimming, or, you wouldn't want to go do hot yoga afterwards. But otherwise, you're back in business after the treatment here. The last special has to do with hormone balancing. So getting $50 off your consult to see how hormone balancing can help you, because you don't have to be going through menopause, change of life to benefit from hormones. They can be out of balance for a variety of reasons.
It's interesting. I just got back from a conference in Nashville, and there was a lot of talk about use of, especially for postmenopausal women, use of hormone replacement therapy to really help decrease the rapidity of aging, right? Like how fast you're aging. And I think a lot of times people don't think of the cosmetic benefit of hormone replacement, but it is really important that you're maintaining, especially estrogen
Mhm.
levels, because as we lose estrogen, you know, we already are stopping collagen production in our 40s and things really slow down. Once you're hit menopause, you're really not making new collagen or elastin without a stimulus and
Right.
like a cut or a wound and a healing. You know, you have to sort of turn on cells, and we're gonna be talking a lot about that, but turning on these cells in response to injury to the skin. But I think if you can maintain those hormone levels, you'll see the loss of collagen happening slower, and also loss of bone, which is really
Right.
important post-menopause. We lose a lot of bone, especially women around their mouths, and really considering hormone replacement therapy if you are reaching that pre and postmenopausal time.
I'm a big fan. Started premenopausal. I'm way postmenopausal now, but really love the benefits of it. So those are our specials for June. We're going to talk
Yeah.
about exosomes
We're
today.
going to talk about exosomes and growth factors and all sorts of new things. You know, there is a lot of discussion in the aesthetic industry about regenerative medicine. And, you know, I think when you think about the term rejuvenation is helping you look younger, right? Regeneration is helping you actually, on a cellular level, act younger. So you want your cells to act in a more youthful way. And so that's really, I think, the distinction. I think if you can get your cells to act, you know, to behave and act in a more youthful manner, by virtue of doing that, you will get rejuvenation, right? So they go hand in hand. And there are lots of, we've talked about regenerative treatments in the past, like Sculptra, hyperdilute radius, Renuva. So we've got those things, but exosomes are a little different, right? So what is an exosome? So an exosome is a message that gets sent from a cell. Like, in the simplest terms, that's
to
what
another cell.
to another
right?
cell. It's
So
meant
they're all talking.
talking. I liken it to the little bubble on a cartoon. You know, that little bubble you see. That's an exosome, and they're saying in that bubble can vary depending on the conversations being had. Really, in the simplest term, that's what an exosome is. So it's the communication from cell to cell. And what those messages are vary depending on the source, the cellular source. So whether that is from mesenchymal stem cells. So usually these messages, we try to find them from stem cells because those are the most youthful cells we have, right? So we want the messages to really be the healthiest messages that we can find. And so there are something called mesenchymal stem cells, which come from fat, adipose tissue. There are stem cells that can be found in platelets. There are stem cells that can be found in bone marrow. And then there's also stem cells that are derived from Wharton's jelly, or the embryonic stem cells, like from the umbilical cord. I think it's important too to know the donor source from these different things. So you want the healthiest donors, obviously, and so they need to be changing up those donors, those donor cells periodically, so that they have fresh stuff.
Yeah.
And the most messages. So that's important as well. And making sure it's not just a single donor. You want to get multiple donors so that the messages are more varied. So these are all important factors when considering exosomes and the source of the exosomes. So, you know, what's interesting is that, you know, you're hoping, based on the donor and the type of stem cell that they're using, that the messages are good messages,
Right.
Because messages could be bad too. Could be like, you know, make a tumor cell, make
Right.
a cancer cell, right? And promoting that. And so really, again, that's why the source is important, that the messages typically received and given, right? Both given and received in those donor cells are messages that promote health and decrease inflammation and aid in healing and all of those things, right? So, what these messages typically are doing is they're helping cells migrate, so get to where they need to go, proliferate. You want, and not tumor cells, but healthy cells. You want those to proliferate when you've had an injury, right? And then differentiate. So to turn into, like turning on and turning cells into healthier cells. So those are really what we're hoping to get, right, out of these messages, out of these exosomes. The signals we're trying to get are growth factors.
Yeah. And when you consider that what we're doing here are controlled injuries on our patients, so we're very deliberately affecting their skin in some way. We want to take advantage of these exosomes to help to encourage that quicker healing, to encourage those better results in the long run there by delivering all these positive messages.
Yes. I mean, obviously we've been doing these controlled injury, treatments to the skin since, I don't know, well, we opened in 2008. So we've been doing this since 2008 here in Paradise. And we didn't always have exosomes. So, we were just hoping that we're going to turn on sleepy cells just by virtue of the fact that we've done this controlled injury. But we're turning on cells, in my case, of an almost 51-year-old person, right? And my cells are going to act like a 51-year-old cell, where the hope with addition of these exosomes is that we can get my 51-year-old cells to see messages they haven't seen, or that more of these messages and these growth factors than my cells would have normally produced based on my age and my health. And and I'm a pretty healthy person, but again, we're using these messages to turn on activity in older cells that we wouldn't normally see.
Yeah.
So, I think the first thing we started with all of this is we started with PRP, and we've been using that for many years in the practice. Yeah. And then we moved to PRF. Easy Gel is a form of PRF that we actually we manipulate the product a little bit. This actually requires a blood draw. Both PRP and PRF require a blood draw. So these are drawn from the patient at the time of the treatment. And then we spin it down in a centrifuge. And when I say we manipulate it, we actually warm it up. So it almost becomes a gel-like substance, and you can use it in lieu of a filler and things. But you can also just inject PRF or PRP without doing that manipulation and just get injected as a serum. And the hope with this is that your platelets themselves release growth factors. I do think that the issue that we find with PRP, PRF is that it is very it's kind of variable. It's variable because it depends on the patient. It depends on the patient's age. It depends on the patient's level of health. It depends on how much water did they drink in the days preceding their blood draw. How much product, how much did we actually yield? And I think it's hard to quantify the amount of growth factors that you're going to get from each sample. And we've been using that, and it works. I just think that what these exosomes are doing has sort of taken that up a notch, and make them more standardized. So we know exactly how many exosomes, how many growth factors are going to be in these products, as opposed to the variability that you may see with PRP or PRF. And we've been using this for injection into the skin, but we use it a lot for injection into the scalp. I think a lot of these treatments are being used for hair growth as well. If you're one of them out there that's suffering from hair loss, consider some of these options for sure. To Ariessence. Ariessence is a brand new company. It's really interesting. So what they have done is they have taken one of the growth factor types, platelet-derived growth factor plus. They have purified that particular message into a product. That this product has been used not under the name Ariessence, but the same company, the same exact product has been injected into joints for regeneration of joint tissue. It's been injected in the dental industry. It is FDA approved for those uses. The aesthetic uses meant the FDA approval is for topical use. But Airy Essence, again, a pure message of platelet-derived growth factor. And I see this as a really interesting option for hair growth. One, you don't need a blood draw. Two, it's a standardized concentration of this growth factor. It's a growth factor that's proven efficacy, so you know exactly what the message is. That's the difference. This is a very pure message, a message that we know is effective.
You'd say this is more clear and consistent.
Yes.
This is more variable.
I just think it's great for men, women who are looking
Right.
for a more guaranteed message to be sent and delivered to their scalp to grow hair.
Yeah.
So this is a little different than other exosomes,
Right.
right? So what the other exosomes that we used one called Benev, which is a adipose derived.
Right.
We tried that and it worked great. We've also tried anti-age now, and we're going to be trying plated. So the difference is the source, and so we're really trying to really hone in what we feel is the best, right?
Right. For what we do here.
For what we do and for our patients. What is going to be the most cost-effective solution, the most effective solution, getting them the best results. So again, we tried the adipose derived with a company called Benev. We've been using the anti-age now, which the source for anti-age exosomes is 50% bone marrow and 50% Wharton's jelly, which comes from the umbilical cord. And there are 10 billion exosomes here. With Airy Essence, I didn't mention, but there's 10 billion growth factors in each syringe of Airy Essence. And then plated is a platelet-derived exosome. Right. And this comes from Mayo Clinic, interestingly enough. And the plated has 15 billion exosomes in each pump. The interesting thing about plated is they have this thing called a renuosome, which is their proprietary delivery system for their growth factors, for their
message.
Their message. Sort of patented this technology to allow it to get in topically.
Right, through the pores, the sebaceous glands.
Yes, through the hair follicles and all of these things, and through the skin itself, actually. By the way, it's fat soluble. Yes.
You don't want it to sit on top. You want it to get in there.
Which is what I think is really interesting, because some of these other exosome companies don't have that same proprietary, yet they're only FDA approved for topical use also. Right. So anyway, so we're going to be trying the plated, has more, 5 billion more exosomes. It has this renuosome technology to get in topically through the skin. They do have a hair product, which I'm interested in trying. Yeah. And then their topical product for use after procedures. And then they have a home care product that, they have really great before and afters, but for showing sort of results with use in office after procedures, but their results really shine when you see ongoing use at home with their home care product. So stay tuned, because we will be playing around with plated in the coming months, and we have seen great results with anti-age too.
Absolutely.
So we're really happy with all of them. I think we're in our exploratory stage. Like I said, it's all buzzy right now. There's a million other companies out there that are making these exosomes. There's even plant-derived exosomes. As a note, because I think people get worried about sterility and sources and all of this stuff. None of these are stem cells. There's no cellular material in any of this. These are just messages that are usually proteins that are produced by stem cells, and we are able to isolate those proteins and in a sterile way, right, to maintain efficacy and sterility and all of that stuff, and packaged so that we can use it safely on patients. So, I'm really excited about the plated option for topical use. So if you have any questions about exosomes, please feel free to chime in the comment section, and we'll be sure to answer all of those questions to the best of our ability. This is a growing field, growing, science.
Yeah, and we're very familiar with it. We've had a lot of great experience.
So with Elicor, when we first started using it, we were very pure with it, right? So we
Right.
weren't putting anything because the FDA trials with that procedure, they just used Vaseline afterwards. So
Nothing
we were
else.
just using Vaseline, but then we started using exosomes, and with that procedure we usually do it at least 2 times. So we treated patients without it, and then we treated them with it, and it was remarkable how much faster they healed with that second treatment
Right.
when we used the exosomes. So now we're really recommending that to anyone who's doing Ellacor. I certainly would recommend it to anyone who's doing CO2. I mean, I had a CO2 a week ago.
Right.
You would
You'd never
know that I did that. And honestly, I was here at work. Today's Friday. I was here at work on Tuesday, and I had the procedure done on the Friday before that, and nobody really knew.
Mm-hmm.
And I used exosomes. So I actually used half of a face of Air Essence and half of a face of Anti-Age because I was just playing around with it. But I healed up remarkably fast,
Mm-hmm.
and I'm really happy with my results. I actually think I'm pleasantly surprised. I had like 0 hyperpigmentation, and I healed up just incredibly quickly.
Yeah.
So I think patients will really like that too, because typically the downtime after a CO2 is about a week.
Right.
And here I am.
Yeah.
I mean, I'm just a week today,
Right.
and I'm super pleased.
And me, when I do a CO2, normally a week out, I'm still looking like a cherry tomato. People know that I've had something done,
Mm-hmm.
you know? So
yeah, I think it's going to make treatments more accessible for patients too, because they won't have that fear of extended downtime.
mhm.
And you can use it anytime really you have a controlled injury to the skin, like RF microneedling. We have the
Yeah.
Morpheus special this month.
Right.
Like Clear and Brilliant, microneedling, CO2, Cool Peel, Ellacor. I think any of those treatments you can pair with these exosome treatments, and then even without an injury to the skin, with something like plated,
Right.
they've shown that because of that technology and their ability to get those exosomes through the stratum corneum, through the skin, and into to the areas that we need it, that it is effective even without that injury. Obviously, we would still recommend using it in addition, like at the time of a treatment,
Right.
but then continuing to use that on a daily use. Anyway, thank you all for joining us. Cheers.
Cheers, everyone.
Happy June.